You're listening to the Public Health Entrepreneurs Podcast with your host, Dr. Charlotte Huntley. Greetings, everyone, and thank you for joining me on this episode. Welcome to Public Health Entrepreneurs, the podcast for visionary leaders who are ready to transform public health and healthcare through innovation. I'm Dr. Charlotte Huntley, and I'm your host. As a public health entrepreneur with over 25 years of experience in healthcare and in public health, I do understand the unique challenges and opportunities that come with bridging multiple disciplines. Now, if you are an interdisciplinary professional, a high-functioning leader with expertise across different fields, then you know what it's like to see opportunities that others often miss. You also understand that the gaps are where they are in the current systems, and you have ideas about how to make things better. Sometimes having a unique perspective can feel a little isolating. You may even feel a bit divided across your different disciplines or fields of expertise. I completely understand that, and I relate to that. It resonates with me. But I also want to encourage you. And in today's episode, we are going to specifically talk about bridging disciplines. Let's start by focusing on setting our intention for the week, and I'll share some actionable steps with you. This week, this is an intention that you can try on for size and see how it feels. So this week, I celebrate my ability to think across different disciplines. Instead of feeling divided between different fields, I recognize how they complement each other. How does that feel for you? Try that on. I know I love reading these out because I've thought about it and I'm sharing with you what fits for me, and I'm hoping that it will help you. I'd like to share some reflection questions as I've been doing across the last few weeks to help you. They can serve as journaling prompts, but I recommend that you give a few moments to reflect over each of these questions and see what rises up for you. So these are questions you can ask yourself. Number one, how do my different disciplines enhance each other? Think about it. Number two, where have I successfully merged approaches? Because you've already done it. You've been doing it. And sometimes it's hard to really stop and think about it. You may do it as a second nature, not really thinking much about it. Number three, what new combinations could I explore? A lot of you are thinking that right now. Number four, how can I better integrate my knowledge? And number five, what unique solutions emerge from my combined perspectives? I would love to hear what comes up for you. This will make such a great conversation starter for us if we were to sit down and start to talk with each other about this. But I encourage you to explore this, to journal your responses and to think, really reflect on these questions. Here are some action steps that I can suggest for you as you kind of move on and embrace this intention for the week and start to embrace more of your multiple disciplines. You can start by knowledge integration. You can map out where your disciplines overlap and then identify synergies. This can be very powerful. Create connection points. Where do they overlap? And plan some integration projects. Someone comes to mind that I recently spoke with, and she had already found the overlap. This is for two specific areas for her where they overlapped. And I think she felt more like she needed to defend her belief and why they overlapped. And I don't want you to be in that situation. It's exciting. It should be exciting when you see the overlap and you see where your two disciplines or different disciplines can overlap and where that intersection is. So the next action step or action item that I recommend for you is innovation development. So list the cross-discipline opportunities. What are the opportunities that lie at this intersection of your disciplines where they overlap? Design hybrid solutions. You may have already been doing this. Create implementation plans. Like, how are you going to implement, your idea? The person in the example I shared with you just a moment ago, there was a very unique overlap and she had some really creative ideas. But they weren't like so, oh my gosh, this is so crazy. I never thought about it. It was actually very simple, like, oh wow, I didn't ever think of that. It's very simple and subtle, like almost like an aha moment for people when you present your solutions in an implementation plan for, how they intersect. And then set success metrics because you're the only one who can define what success looks like for your program, your solution. Okay. And then the third strategy or action step that I will recommend is a communication strategy. Develop shared language. Every discipline has its own type of language, right? Epidemiologists have their language, lawyers have their language, doctors have their language, medical doctors. Look at the opportunities for where there's shared language between your different disciplines. Create explanation frameworks. This can be a really fun project to do. I had a client project as a consultant, had a project with an organization, and they had so many acronyms for everything. And I remember making a comment to someone. I said, you almost need a cheat sheet for your acronyms. And like, actually, they had a coworker, had an employee that had created one. They onboarded, and within that first 6 months or so, they felt the same way. And they created a cheat sheet for, what all these mean, just a quick reference. So create explanation frameworks that can interpret some of the language, or maybe where they overlap, or maybe they're completely different. But I think that could be a fun project as well. Plan stakeholder education. How are you going to educate your stakeholders and explain the differences? That can also be fun. It's a great way to have conversation with your stakeholders and build a relationship as well. And also be seen as that trusted resource because you're sharing that information and helping the communication to be improved. And then design collaboration tools. What ways can they be shared and used, and just ways to bring the stakeholders and seemingly different disciplines together. Building a common language is crucial. Like, different fields often use different terms for similar concepts, which can create confusion, as you know. Create simple frameworks to explain ideas across those different disciplines, and invest time in teaching team members about each other's fields. This might mean creating glossaries, visual guides, or regular knowledge sharing sessions where experts can explain their field's perspectives in accessible terms. I think there are so many opportunities for this type of collaboration in this exercise. So number 4 is project implementation. So select a pilot project and build cross-functional teams. This is really important. This is a great way to bring people at the table of your different disciplines together as a cross-functional team and create workflows with these integrations. Monitor your outcomes. I think it's going to be interesting to see what they are, but it's important to monitor. Finally, put your plans into action with a carefully chosen pilot project. Pick something relatively small enough to be able to manage, but significant enough to demonstrate value. So build teams that mix experts from across different fields to create clear workflows that respect each discipline's methods, and carefully track the results. Success isn't always the initial project. I mean, it's the goal and the focus. You want it to be successful, but it's in the initial project, you can build momentum across these different initiatives, and the success can be a part of that momentum. So it may not be instant. It may come across over time, but for the larger cross-disciplinary initiatives, it's important to build and create that momentum, and all of these different factors can be a part of it. By bringing together different disciplines to tackle public health challenges, we're not just solving problems, we're transforming how communities approach wellness. This is huge. Whether it's environmental scientists working with epidemiologists to track disease patterns, urban planners designing healthier neighborhoods, or behavioral psychologists helping craft more effective health messages, these collaborations create powerful solutions that no single field could achieve alone. And when I say this is huge, this is huge. This is what we seek. We want to have big impact. And when we can bridge multiple disciplines together, there is incredible potential for great impact. I have a colleague who runs a business as a grant writer, and she focuses on cities and municipalities. And She often talks about the work that she does and the overlap of these multiple disciplines. So she's bringing funding through her grant writing efforts, and she's working with cities. And there may be engineers and environmentalists and different people at the table. And she's able to see how there's so much overlap in how parks are created or roadways are designed or intersections are created and how it impacts people in the city and how they're able to use the transportation system. And so when we're able to have these interdisciplinary projects, we're also able to have this interdisciplinary impact. The key is staying flexible and measuring what works and always keeping community needs at the center of our efforts. When we break down the silos between disciplines, we build stronger, healthier communities for everyone. Setting an intention along with these actionable steps will help you create a framework for how you want to experience your week. They help you stay aligned with your values and maintain focus on what matters most. As we wrap up, I'd like to remind you that if you are ready to work with someone more closely to fully explore what's possible for you and your vision, then I invite you to consider working with me. Right now, I do have capacity to work with people one-on-one. I don't always have that, and you really won't see it directly on our website as a page, but you can certainly contact us through the contact page, reach out and send a message and say you'd like to explore the opportunity to work with me one-on-one. As a public health entrepreneur who works with high-functioning interdisciplinary leaders, I provide the trusted soundboard and guidance that you might be looking for. Feel free to reach out to me directly through our website, which is publichealthentrepreneurs.com, and I'd be happy to discuss that option with you. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. Visit publichealthentrepreneurs.com to learn more.